Hello and welcome to Cutting Edge Pain Relief. And today we're talking about an app that uses brain power to be able to relieve pain. I know that sounds a little bit, as we described it earlier, as a little bit like malarkey, but actually there is an underpinning of science that really is starting to gain further and further traction. Today, we're going to talk about how audiovisual entrainment is able to improve pain without an invasive component. So really, when we get down into this, it's using something that we have spoken about in other lectures that are things that are called neuromodulation. Traditionally, when we talk about neuromodulation, it's in the context of invasiveness. So things like spinal cord stimulation or peripheral stimulation. And what it really means, to kind of get down to the nitty gritty of it all, is that basically it's a science of taking input of nerves and being able to change it in ways that's going to be complementary to what we want to be able to do. In essence, the motto of our channel is biohacking your pain. So how can we be able to improve your overall pain by doing various things to tweak the elements that are causing the issue? So we're going to talk a little bit about the app, where it originates from, what's the underpinnings of it. But before we get to that, we need to talk about pain as a whole and how that pain can be influenced from the nerve standpoint and from the mind standpoint, and really have some scientific understanding of that. So some of the things that we need to look at are things like this. So if we take a look at the context of the brain and how it impacts the aspect of the spinal cord. So the top left is the aspect of the brain. It has a couple different areas that are influential on the areas that can impact the spinal cord and how we perceive pain. And there are different theories that are out there, right? So there's specificity theory, there's gate control theory, there's top-down modulation, and all of those are fancy ways to talk about different parts of the brain can affect how we experience pain in different ways. So when we talk about the prefrontal cortex, that's the front portion of the brain, and it has implications in emotional regulation. We talk about cognitive regulation. It is associated with a part of the brain that's called the anterior cingulate cortex. We talk about sensory regulation. We talk about the somatosensory cortex, and all of those things have connections in the middle and in different parts of the midbrain, all the way down to the spinal cord, right? So we know some of those things, but the question is, how do we really utilize it? Many years ago, in decades past, we talked about cutting different elements of the aspect of the brain, or cutting different parts of the cord, and hoping that that way we could be able to interrupt the tracks. However, as we have figured out, and we probably should have known before, is the brain and the body is pretty darn complex. And what happens is there's rewiring that takes place, and it basically circumvents the cut frequently, so that the areas that we've tried to target and lesion don't actually stay targeted and lesioned. So instead, what we need to do is to basically deftly take those tracks, those methodologies of being able to try to stop that pain from being perceived, and modulate it, move it from one element over to another, right? And so that's going to be something that we're going to talk about in terms of how this actually works. So let's give you a quick preview of the aspect of news anchors kind of giving some insight and a quick blurb about exactly what that means. And from there, we'll talk a little bit further about the elements of what this means, where it comes from, and how it might be able to help you.
Isn't it?
There are mobile phone apps these days for everything. Shopping, helping you get fit, even finding love. But one has been developed to help people who have chronic pain.
Yes, scientists at Manchester University believe that flashing lights on the app will help tune the brain to alleviate and ease any pain. You simply slot it into goggles. And as you might imagine, Ian Haslam's report contains flashing images.
So I'll give that to you. Rachel has fibromyalgia, which causes her chronic pain. For years, she's relied on medication until a recent test with this new smartphone app. The idea is that the flashing light can tune the brain into what's known as alpha frequency and alleviate pain.
A lot of people would think that looking at flashing lights would give you a headache, would cause you a problem, but for you, it's just the opposite, isn't it?
Yeah, it's quite relaxing. You just kind of fall in with the lights and you can feel your body easing with it and the pain just goes. I can't explain it any better than just have no pain.
The light therapy has been developed by scientists at the University of Manchester who hope it could eventually benefit nearly half the UK population.
We don't know yet whether it's going to revolutionise pain treatment. So far, our preliminary results have been very encouraging. The idea.
Okay, so when we really kind of get into this, we have the understanding that there's a possibility that maybe this has some substance, right? But what we're really curious about is what's the scientific underpinnings of this? Is this really true? Or to kind of be kind and not choose the word that we are always would probably choose behind closed doors is we'll use malarkey. Is this really something substantive so that I don't place my hope into something that may not have true value? And what we see is that this is not a new option. It's actually been out for years. The question is, has it been done well? And I think that's where we start to see that there are technologies that are out there that can be able to be utilized, evaluated, and improved. And so one of those technologies has actually been produced by a company that's called Mind Alive. And as a matter of fact, we have some experience with that, but giving some insight, we will let the actual founder developer talk to you a little bit about that. And then we'll go back and kind of delve into that University of Manchester app. What's the scientific basis, how it was presented within one of the British journals of pain, and what did they find, who it worked for, what were some of the downsides, and what might be the value to you. So getting into that context, let's give you a little bit of insight about what audio visual entrainment is, how it's impactful, and how that might be pertinent to you.
People can imagine building blinking lights in their basement. It's not hard to do, but to do good quality blinking or audio-visual entrainment is very difficult. It takes a huge amount of work to do good quality stimulation, and I think that's why, and also the science behind it is getting very complex as well. And I think that's probably why so many companies have come and gone, because they don't address that. Okay, so let's get into what is audio-visual entrainment. Here we go. Well, with entrainment, you can do all kinds of things. You can adjust frequency of the brainwaves, which Adrian and Matthews found out. You can dissociate people in a meditative kind of way. It's very effective at breaking the HPA, or hypothalamic pituitary adrenal axis. So when people have flight or fight, you can calm people very, very rapidly on audiovisual entrainment. It increases cerebral blood flow quite remarkably, and lactate and anaerobic ATP. It balances neurotransmitters. It excites neurons and glia. It increases heat shock protein 70, which is important. And a recent study just came out where it activates specific cytokines. And I don't have a slide on that study yet. It's a very, very complex study, and I don't know a lot about cytokines. So I'm still learning about what that means. But as you can see, even though the concept of brainwave entrainment really implies frequency is just a small amount of what entrainment does. And there are times you don't have to use the so-called correct frequency from a neurofeedback model at all, and you still get remarkable results.
Okay, so as we kind of got that aspect of understanding, we were able to figure out that there are different ways that this very well may work. It may work on the context of the wave frequency. It may work on a molecular aspect that it has an impact on the cytokine components and how that's impactful. It may work on the aspect of how the pituitary axis is influenced. But at the end of the day, it's been able to show some value to some individuals. So let's get into understanding exactly what does that mean, how it might be impactful to you. And if there are questions, by all means, please ask for those of you who are live with us right now. One of the things that I would say is that this is not going to be a solution for everyone. We know that's the case. But the upside is that it's not an invasive type treatment option. As we find when we delve into the literature, there are some exclusion criteria for who would be a fit and who wouldn't be a fit. So exclusion criteria, just to reiterate again, as we talk about when we delve into papers, are individuals who are not a candidate for this type of treatment for various different reasons. Typically because there will be some type of deleterious or harmful impact to them, right? So one of the things that's mentioned is the context of seizures, and if you have a history of seizures, but also when we get into kind of the paper and literature that refers and specifically to that University of Manchester app, it also talks about headaches, and we will talk about that a little bit in depth and detail. So when we get into the paper, give me 1 second, and we'll kind of delve into that in depth and detail. It was actually published in the British Journal of Pain. And what was put forth was the acceptability and usability of a smartphone-based brainwave entrainment technology used by individuals with chronic pain in a home setting. Yeah, that definitely was a mouthful, right? So, okay, let's break this down like we do typically, and we're going to have an explanation of what that really means. So this talks about the rhythmic, visual, or auditory stimulation, and we'll get into that in a little bit, but it looked at participants. The power was low, meaning there wasn't a lot of participants that were in place, but it was applied at home for 4 weeks. And that's a lot of value, particularly right now with some of the things that we're dealing with, right? And what they really were able to find is that there is a degree of improvement for many people, and they gave qualitative, not quantitative, qualitative responses, which I think is what is really important for a lot of people. When we talk about quantitative, sometimes I think it's kind of lost, because I can tell you this person's pain went from a 7 down to a 2, and it sounds significant, and it is pretty darn significant. But at the end of the day is, what does it mean to you? So qualitative, sometimes in the description, lets you understand where that person was coming from, almost like they gave you a story. So we're going to talk about where this paper alludes to, but we're going to get into some of the background understanding of what that really means. And again, if there are questions, by all means, jump in and we'll field them as those questions come up. Okay. So as we get into this paper, which is in reference to that study that we talked about before, it looked at the aspect of pain and many different treatment options that were in place that we all know that people use. So things like opioids, things like nonsteroidal anti-inflammatory medications, and how we might be able to impact that. And what they looked to do was to be able to take the technology that we referred to before of using things like goggles that you would have in a lab and convert it to the aspect of an app. And there's various different frequencies that have different impacts. But at the end of the day, that's really what we're looking for. So inclusion criteria, meaning, again, who are the people who are included? So what they really were looking for were adults age 18 or older who had significant pain for greater than 3 months and were able to consent. And the exclusion criteria, as we can be able to see, were people who, meaning these weren't people that were included, were if they or other relatives had epilepsy or convulsions/seizures, if they had discomfort or eye twitching with flashing lights, if they had severe or frequent headaches, and if they had a current hospitalization during the study. As we can tell, it was a British literature that's in place, right? So really what they did is they looked at patients. I know frequently there are questions that pop up about what age range was this, but they looked at an age range which was a mean of 47 years, but people range from 22 to 71 years of age. And what they were looking at is what was the impact of how this made a difference. If you recall from the video, these were the goggles that they were using on the app, and they're able to have the component of the phone, which are actually allowed for them to be able to pick out what was the aspect of the flashing as well as the beats that were in place, right? So one of the things that they really were able to do is to put together a qualitative data collection. And so what they did was able to get these quote unquote illustrative quotes. And so I think this may resonate with some of our viewers and listeners, but at the end of the day, what they said is, to kind of paraphrase this, is when you're in sort of a vicious cycle, you don't realize just how small your life is getting. You stop doing things because it's too much of a struggle, and you start adjusting everything you do to manage pain, right? And what they were looking at is, how was this impactful, right? So the constant, do I take painkillers and not be in pain, but then not be able to function again? You know, it's not always an easy decision. So then they talk about, you know, what's happened afterwards. It was miraculous. I reckon I've gone from probably being reliant on anti-inflammatories to 80% less. Yeah, I'm really keen to know about the science a bit more and how it works, but at the moment, I'm just happy feeling confident that it works. Right, and so this is the conundrum that I think really good quality medical providers, not just physicians, nurse practitioners, chiropractors, other individuals that say, we want to help people, but we're not looking to basically take advantage of individuals. It's not just about us getting a placebo effect only. What we're looking for is it sustainable? Is it repeatable? And can it really impact people from a larger, bigger scale? And that's one of the things that I think this science and other sciences that are coming into themselves in terms of that neurotherapy and neuromodulation piece is one of the reasons why it hasn't been traditionally accepted by a lot of individuals. However, that science is becoming much more developed and much better understood. And so from a patient's perspective, at the end of the day, what we really care about is the following: is number one, does it work? Number two, will I feel pain while I'm trying to get better, or is it going to harm me in another way? And number three, can I afford it, really? And those are going to be the options I think that are important to patients. And we want to hold those dear to the heart and definitely have an understanding about that. But at the same time, from a scientific and from a medical standpoint, we also want to know that we have substance behind it, and that it is going to be not just for a few select few that get benefit, but can we have people be able to get benefit as a whole, and that there's a way to be able to make this repeatable, that there is not just something behind the curtain like in the Wizard of Oz, but is there something really substantive? So when we get into the components of this, that's where some of the qualitative pieces I think resonate really well with patients. But then what we want to do is to be able to pair that within the context of how does that impact individuals from a different standpoint, right? So this is the reality of it, i.e., I haven't noticed any difference. Some weeks are better than others, but again, I have no idea what that would be attributed to. I genuinely have good and bad weeks. Other individuals that say it's fine during the day, but when you're feeling a little bit of pain in the evening, you have to go out of the room or stay in the living room with the rest of the family and say, I'm just going to put this on. Putting that on then didn't seem to fit right with me. But there are other individuals that say you could just go into your own little world with it. It was comfortable. You could just relax into it and let the time pass, right? Some would say it could have a really big impact on the way you feel about something if you feel like you're actually helping yourself and if you're not relying on someone else to fix the problem. Others where it just made me feel a little bit anxious. It was mainly just like how bright it was. I don't really do well with flashing lights and things. It just made me feel quite dizzy and anxious. So as we would expect, there's a wide spectrum of how AVE may impact individuals, but let's kind of go back to that context of understanding from the researchers at University of Manchester what they thought about it, how they considered it, and how it might be impactful to individuals from a differing perspective, right?
Is trying to develop a technology platform that allows us to facilitate patients brains taking more control over their chronic pain. We do this in two quite simple ways, really. One is to expose people to a light that's flashing in the alpha range, which we've discovered suppresses or helps to suppress pain responses in the brain.
It's very, very interesting because it's so new, you know, for a start. And I have the ordinary sort of chemical pain relief, you know, of taking tablets. But this, I think, is a great future in these other alternative ways of looking at pain relief, really.
And the other approach is more active. So we're actually giving patients feedback on how their brains are responding and encourage them to express more of these alpha waves in the brain that we think are important in controlling how unpleasant the pain actually is.
Okay. So I know there was a question that was posed in our teaser earlier that asked, is this neurofeedback? And although it's akin to neurofeedback in some contexts, that second point that was mentioned was that aspect of assessing what were some of the changes that took place. We're going to come back and talk about that in depth and detail in just a little bit and answer any questions that you might have after we have a little bit of a break to have an understanding of our channel, what we're trying to do, and how we're looking to help people. Okay, so we're back with Cutting Edge Pain Relief, and today we're talking about audiovisual entrainment and how it might be impactful for pain relief. So one of the things that we really want patients to understand is that this is another option that's non-invasive in nature that may be able to provide some degree of pain relief by using the brain to be able to influence pain elsewhere throughout the body. And it has implications for different parts of your body, as well as different pain states and conditions. So when we talk about audiovisual entrainment, there's multiple different parts where it's not just visual. You also have an auditory component that can be able to provide some degree of relief. And really what we're looking at is ways that it's going to mesh well with you. So when we talk about audiovisual entrainment, as you've heard multiple different times, was the context of the aspect of brain waves and frequencies. So one of the elements of that is something like this. So when we look at AVE, it's using those pulses of light and sounds at specific frequencies to gently and safely guide the brain into various brain wave patterns, right? And by alternating your brain wave frequencies, you can boost your mood, improve sleep patterns, sharpen your mind, and increase relaxation levels, all with a simple push of the button. When you take a look at those things that are looked at down below, they show different waveforms, which are the frequency, right? So on the slow end, you have things like delta waves, which are going to have the components of deep sleep with 1 to 4 hertz. The next step up, you're going to have things like theta waves, which are going to be as you start to fall asleep. Alpha waves, which are going to be that relaxed component from 8 to 12, and beta waves, which are going to be that aspect of being awake/alert, right? And so all those different wave formulations have impacts on potentially being able to alter your overall state, how things are, how you progress and how you feel, what the sensations might happen to be, and how you are able to deal with pain from a lot of different levels, right? And so when we talk about that, these waveforms are what we're looking to influence and also hopefully potentially be able to measure. And when we're able to measure those things, it lets us be able to say, how far along have we really been able to gain and garner some degree of impact? So is audiovisual entrainment a potential panacea and a phenomenal pain relief for every person? No. But does it have potential options that are out there, both in app formulation as well as in traditional kind of goggle device type applications? Sure. So when you take a look at what would be that experience without those of you who have seizures who might want to turn your head or things that flashing lights kind of bother you, one of the ways to really be able to kind of look at that is within that aspect of traditional goggle type formulation. So you kind of have something like this. And then when you take a look at it, you can be able to see those flashing lights that are in place. You can slow or increase those flashing lights as you see fit. And that's going to be a great fit for you. And then be able to measure it thereafter with something like a quantitative EEG to assess exactly where your wave formulation happens to be and how it's improving your pain, or are you staying at a baseline? And those are the things that we really look at when we're talking about doing things of this nature, and how to continue to be able to look at science that's advancing options for patients so that you can basically figure out a way to punch pain in the face and get back to leading the life that you deserve. Again, thank you for joining us on Cutting Edge Pain Relief, where we teach you how to be able to biohack your pain and get back to leading the life that you deserve. Have a great day.